बैगर्स को कोई बीमारी है?
डायबिटीज क्यों?
डायबिटीज में अगर सीवियर हाइपरकलेमिया हो तो पेशेंट हॉस्पिटल पहुंच जाता है।
As told by the actor, yes, diabetic patients are at risk of hyperkalemia. We will see what are all the causes of hyperkalemia in a diabetic patient in this video. Will all the diabetes will develop hyperkalemia? No, only those who are at risk, and if multiple uh, pathological process somewhat coincide in a disease process, hyperkalemia can occur. The first is the hyporeninemic hypoaldosteronism. We can say it as type 4 RTA, renal tubular acidosis, which is very common in diabetic patient. And why this occurs? It occurs because the juxtaglomerular cells, which are located in the glomeruli and the vicinity, in the afferent arteriole, and the gap it is located between the afferent and the efferent arteriole. Because of the diabetes, there are changes in these capillaries which lead to the dysfunction of these J cells, which result in decreased renin, thereby decreased aldosteronism. So, because of the diabetes, there is a damage to these J cells, or we can say malfunction, thereby low renin and low aldosteronism, which is called as type 4 RTA or hyporeninemic hypoaldosteronism. The second one, most of the diabetic patient might be on ACE inhibitor, ARB, or aldosterone blockers, which are at put the patient at higher risk of hyperkalemia as these drugs block the renin, angiotensin, aldosterone system. These are the RAS inhibitor. For one or other reason, clinically, this patient might be on ACE inhibitor, ARB, thereby increasing the risk of hyperkalemia. The third one, diabetic nephropathy itself. Diabetic nephropathy causes renal dysfunction, which might lead to CKD. Whenever the kidney is not able to perform its function in the form of excreting the adequate amount of potassium, the patient is again at higher risk of hyperkalemia. And this is what, as a clinician in the nephrology OPD, we commonly encounter. Chronic kidney disease, because of diabetic nephropathy, patient presents in hyperkalemia. The fourth one, if we take the physiology, insulin puts the potassium into the cells. The resistance or the deficiency in a diabetic patient put the patient at the risk of hyperkalemia. The last one is the acidosis. Because of the pathophysiological process which is associated between acidosis and the potassium, whenever there is an acidotic menu in the form of diabetic ketoacidosis, there is a risk of hyperkalemia by shifting out of from the inside the cell, potassium gets shifted outside the cell, thereby causing the hyperkalemia. And one more subtle point is the dehydration and hyperosmolarity. Whenever there is a dehydration and hyperosmolarity, through the various pathophysiological processes associated between intracellular and extracellular component, potassium gets released along with the intracellular water to extracellular water. The potassium in the extracellular compartment increases, thereby increasing the potassium level. So these are all the 5 common causes of hyperkalemia in a diabetic patient. Not all will develop. Yes, they are at increased risk of hyperkalemia because of these situations. So that is why the actor told diabetic patient look out for hyperkalemia. Bye bye. We will see in the another video tomorrow.